I just want to say thanks to everybody and to Edgar, but to everybody for participating this morning. I'm hoping while he's still here, maybe he'll chime in where needed, and everybody else who participated too. I think probably it makes sense to summarize a little bit what we talked about in the morning and what we talked about in the afternoon. Because I haven't had a ton of time to collect, and because of the process, this may be filtered through my own personal lens, so please correct me if I got it wrong and you were there. I would say that in the morning, it was a robust conversation that was wide-reaching and really verged on the philosophical multiple times, which is probably appropriate for this type of topic. In broad strokes, I think we covered in the morning some version of like, how are we thinking about this? Like, what are the assumptions that are made even by this group coming together to think about it in this way? And do we even buy into those assumptions and theories? And can a framework that comes out of this type of group and this type of thought process be anti-racist? I know you're going to be sorry to hear we didn't find out an answer to that, but we did consider it and tried to use that as some way to think through some of the questions. We also talked a little bit about goals in broad strokes, like what are the goals of this type of process? What does a goal of anti-racism look like? And how would we define these goals, discuss these goals? We talked a little bit about language. I think even within this fairly well-meaning group, there's some language that raised some discussion about whether that's in and of itself constrictive language. And so we changed some terms specifically that we were talking about and terms that we were using, because I think it's not the goal to encode in this language that really that really doubles down on some sort of racist or really restrictive ideas. And I think the idea of like interpersonal systems and structures such as mentorship came up enough that it should probably get called out all by itself. And then we looked at each question that we already had and tried to, in the morning we did a little bit more lumping, I would say. So we sort of took the questions that we came into the session with and really tried to kind of lump them together and streamline things a little bit. Hang on. And then in the afternoon, by then we had taken, what did we start with? 10 questions and whittled them down to 5, I think, or rather lumped them together into 5 total questions. Then in the afternoon session, we started with those 5. We came up with a 6th that we added, which is a little bit outside the process, we understand, but we did come up with a 6th, and then we did a round of voting that included all 6 of those questions. I'm wondering, first of all, does anybody who was there have anything to add to that? Because I don't, or thoughts, refinements? All right. I read this thing recently where, like, if you ask a question, you're supposed to wait for 15 seconds to see if anybody answers. It's like a long time. All right. So now at this point, we only have 6 questions. Do you want, should I read them and then tell the votes? Or does anybody have a different way they want me to do this? Like the Oscars, okay. Oh gosh, these are some, these movies have some long titles. All right, so I'm going to read them in the order. I'm going to read them in the order in which they finally came out for us, and I guess I'll read the number of votes or the number of dollars that they got after each one. So if you want to really be tracking, get out a pen. All right, so question 1A, so this is our second round, is, are current educational paradigms useful for aligning with DEI goals of anti-racism? And then we gave some sort of, I guess, pillars that this could be looked at. So pedagogy, paradigms, frameworks, and stakeholders. And that, question 1, got 1,190 sticker dollars. Question number 2. Please stop me if you have any questions. Question number 2. What curricula, educational strategies, and assessment methods are needed to best support evidence-based, equitable, anti-racist emergency care and practice? That got 2,000 sticker dollars on the nose. Question number 3. What are best practices for engaging patients in the community to collect regional input and values to inform/improve inclusive emergency medicine education? That got 1,030 sticker dollars. Question number 4. How can we identify and overcome systemic barriers for URIM individuals and minoritized/historically excluded individuals for entering into and thriving in the continuum of emergency medicine education, specifically as it relates to recruitment, retention, mentorship/sponsorship, and development? That got 1,510 sticker dollars. Question number 5. What does an anti-racist learning environment look like? What biased or racist policies, procedures, and practices exist in the learning environment? How do we nurture best practices towards an anti-racist learning environment? That got 1,240. And then question 6, the question that was added just for the afternoon, by the afternoon session, was, what are the measurable benefits of anti-racist education at the individual, interpersonal, and system levels? And that got 640 sticker dollars. Comments? Questions? That is absolutely correct. So I'm sure the smarter people than me could think of possible, that number divided by possible numbers, dollars it could have gotten or something.
So it sounds like if you doubled that, just to give it a possible,
yeah,
then it would be about the same. In fact, it seems like you achieved consensus across all of your questions.
I would say so. If it was doubled, it would be right in that ballpark. It would be on the lower end of the spectrum, but it would be above at least one of the questions.
Perfect. Well, thank you so much. Can we all give her a round of applause?
Thank you, guys. Thank you, Jack.
So next up, I was hoping that we could have the research folks come up. And of course, the research folks have something from a PowerPoint perspective. Can we go straight in?
Yeah, it's issue mine, right? Yep.
Yeah.
Thank you. All right.
Look at that.
So the research subgroup also had a wide-ranging, free-flowing, and passionate discussion in the morning session while we were all still hungry and highly caffeinated. Some discussion points. Most of these came up in the morning session and then were repeated in the afternoon session. My slides did not advance. I said we could just plug straight in, but maybe we can't. But I think, there we go. Sorry if you don't know me, I'm Liz Berner, if you didn't come to one of the research sessions. So one term, we had used bias a lot in our preliminary questions, and something that came up was that the term bias, without putting any other qualifiers or characteristics on it, really avoided responsibility. And so we changed most of our questions to say discrimination, racism and racial bias, because we wanted to stay away from discrimination necessarily, because we are trying to encourage change in that behavior, and that can be a stigmatizing term for some people still. And so while we're still working on pulling allies together, we decided to stick with racial bias. We also talked a lot about how ethnicity does not equal race. We had to pin that discussion in both the morning and the afternoon sessions because it's a really important topic to discuss, but it just takes more time than we have to really debate right now. We also spoke a fair amount about how self-identified racial and ethnic background does not equal what the clerk or a research associate necessarily wrote down, although that is an important part of the social construct of race, what other people identify you as without any other input from you. And so really thinking about those as separate data points, your self-identified race versus your race that's assigned by someone who doesn't know you at all. We talked about intersectionality, and it's critically important. It might be beyond the main scope of the work here, but for any future work or anybody who's interested in developing a future consensus conference, that would be a really interesting topic to discuss. We talked about how patient perspectives of racist care are critical outcomes to be measured, and they're also process metrics for any type of interventions that are aimed at changing racist care by providers or by healthcare systems. And we also, in the afternoon session only, brought up talking about racism by level. So we had talked a lot about provider level we thought of, which is really interpersonal and internalized racism, but that there's also systemic and institutional racism, which we had touched on in the earlier session, but we really talked about a lot more in the afternoon session. So we went in with 10 questions. We added 2 in the morning session and removed none. And then in the afternoon session, we added another 2. We ended up with 14 questions. But there was a pretty good breakdown when people actually put their funding dollars towards things. So the question, how do we measure interpersonal and internalized racial bias, which is the final form of a question that started very differently, but how it ended up, was the highest funded question. How effective are clinical guidelines in eliminating and exacerbating race-based inequities? And do they reduce unconscious bias during times of cognitive stress and cognitive overload was the next. And how do we improve representation and participation in ED-based research? Were the top 3 funded questions, followed very closely by how do we measure patient experiences with and clinical outcomes from racism and racially biased care. And the next 2 were pretty close on the list. Are there best practices in reducing racism and racial bias in care processes and heuristics? And which intervention designs are most effective and for which domains of racism and bias? And those last 2 have like 8 sub-questions that go with them, which we didn't include in this presentation, but we'll send all that information out to everybody shortly. It just did not fit on one slide. And then the other questions were all important, but didn't necessarily reach the same level of consensus as being high priority research questions. How to get leadership and stakeholder buy-in to develop interventions, and to disseminate those findings, to share those findings, and what are legal implications for that. That was from the afternoon only, so if you doubled their score, they still wouldn't have necessarily reached into that top level. What factors increase the risk of the occurrence of racially biased care, and what parts of the emergency patient encounter are these risk factors differentially present? And so by that we meant from the continuum from pre-hospital care through discharged home ED aftercare instructions. Does diversity in the EM workforce reduce biased care, improve patient experience of care, and improve patient outcomes? Which we talked a bit about what's available in other fields and how that might need to be examined differently in emergency care, that there's differences in the patient-provider interactions and might need different assessment tools. Are there biases in EM funding for DEI, and how do we ensure equity for DEI research and researchers? And this is still under development. We talked about how we probably need to separate the D, the E, and the I from each other, and because they really need different research tools to address those. But we also talked about how patient perception of racism and racist care or biased care in any way is not currently part of patient-centered outcomes, And that might be something we need to advocate for on a policy funding level, is to really incorporate patient perspectives of their care into PCORI funding. Oh, my slides did not change for you all. All right, there we go. And then I think we're having, there we go. We talked about reducing racism and racial bias in machine learning algorithmic models for EM-based care, but that there are also probably ways to use AI to improve care, right? And to, if they can be properly developed, remove the personal biases that might be involved in care decisions. We talked about measuring the burden of the minority tax on research faculty and other research workforce members who come from underrepresented backgrounds. We talked about characterizing representation within study populations, and also something that came up in the afternoon session only, and I think is probably room for further exploration in the future, are what interventions are there for decreasing the impact of racism and microaggressions that is patient on healthcare team member, and that currently we don't have a lot of ways to deal with that situation and move forward to be able to then care for the rest of your patients on that shift, and it's something to consider in the future. So that is our report out from research, healthcare research.
And now we're up for the third group, which is the group on leadership. Dr. Wright?
First, let me thank you and Dr. Druck for doing the math for us. Delegation, no. We had a nice, robust discussion this morning as well, fed by coffee, which finding this afternoon we probably needed more of. Anyway, both groups were great. This morning's conversation, one of the main things that was discussed was really how do we find leadership and how do we make sure that we account, probably can hear me better, make sure that we account for all different levels of leadership, maybe not even just within academic emergency medicine, but across non-academic emergency medicine programs, of which ACEP and ABIM and others could help us quite a bit with. We had 10 questions that were posed from the very beginning that we had sent out in our modified Delphi approach. We have 3 really top winners. I know, drum roll, that y'all want to hear about. We had 6 that makes a cut if you want to make a cut, because we sort of want to focus in. And then the others either were collapsed within the questions that we had that remained or were eliminated. So without further ado, the winner question was interesting because it was based around the concept of retention, attrition, and keeping faculty within a program. And so that question was our 10th question, which was, what are the factors that lead to loss of URIM faculty from academic emergency medicine and emergency medicine, and the factors that elicit engagement? So that was really, that earned $1,750, which was the top score. And just interesting around this question, the morning group wanted us to turn this into a positive and say, what are the factors that lead to retention or to keeping faculty? The afternoon group strongly felt that that's a different question than what are the factors that lead to loss, and that the things that make people leave are quite different than the things that keep people in a particular location, and felt that those should really be part A and part B of the same question.
I just would add that there was no consensus with all of these questions, the 10 questions, but there was consensus about what should stay as, the primary questions from the afternoon and the morning.
Yeah, actually, the afternoon and the morning were very complimentary.
Yeah.
It was very interesting, which I guess is good for a consensus conference. The number 2 question received $1,350 to support it. And it was question number 4 on our list, which is identify current practices that have been shown to improve culture, diversity, inclusivity. And actually, the real question that was that got the money was the second part to this is which evidence-based leadership programs successfully increase diversity in leadership roles. Use implementation science framework comparing evidence-based leadership development interventions and outcomes. So this is more about what works. And so researching as to what works was the number 2 priority. Any other comments about that one?
No, just that it was collapsed. There was discussion of collapsing this with question 5.
And then our next, the number 3 winner was question 1. And question 1 was provide updated status of leadership roles / numbers stratified by self-identified demographics, gender, race, ethnicity, LGBTQ+, within emergency medicine. So this was a sort of where are we currently, and it was felt that even though we've had some really nice publications recently that looked at within academic emergency medicine, but that we didn't have a full understanding of where we currently are.
And any interventions that we would put in place, if we know where we are to begin with and you have a base, you can then follow whether or not there's true effect from the intervention. I would also say that there was a lot of discussion, as David said in the beginning, with what is leadership and defining leadership and understanding that there are tiers of leadership, as
Right.
well as hospital-based leaders versus academic leaders.
Yeah, it was almost felt that we needed to put a work group together just to define that before we launch into a research project. Is what are the tiers and what does that mean? So those are the top 3, and that last one received $1,080 to move those 3 forward. So I think those are really clear winners. Then we get into sort of our mid-tier, which is question number 2, received $990, and is provide a descriptive analysis of the challenges stratified by self-identified demographics, gender, race, ethnicity, LGBTQ+, within emergency medicine, include academic rank, leadership titles, and other factors. And so this is the one that we're talking about would probably be folded into question 1, frankly. Any comments on that one?
No,
Okay.
that's it.
Then the 5th funded is $820, and that went to question 7, which is develop national standards for valuing professional stewardship activities to improve diversity so that the full range of quantity of their service activities in fact are factored into decisions about promotion and leadership. URIMs are more likely to serve on underrepresented communities was the concern and the concept within that question.
I guess I would add that there was a lot of discussion about what value is and how to define value. So to use the tool as a way of advocacy, because we understand that these values that we would assign some kind of weight on are, whether they're accepted by the institutions and the APT committees, we don't know in each of the institutions since they're so different. That said, the chairs can actually use an instrument like this to advocate. I think it was also mentioned using the REAIM implementation framework, and so you could actually study something like this to see whether or not there was some change going forward.
Yep, that's great. And then, so 820 is where we think you could make a legitimate kind of cut point. from the next one, which was $430. And so this one, we'll have to make a decision once we sort of get around and start looking at the data as to whether we want to go with those or include this next one, which is describe the components of a successful program implemented to increase diversity in medicine and faculty level. And I think this one actually goes along. I don't know if you remember number 2 that I had that was about action. And I think this could be collapsed into that. Yep, and that's it. So I don't think you want to hear about the ones that didn't make it. So any questions? Quiet group, no coffee. I feel like I'm in a Baptist church. Everybody's sitting in the back.
Thanks to the leadership group. Thank you. We did a lot of work today, and the groups have a lot more work to do based on today's discussion. And the plan is to write up this research addenda for publication based on all of the work and all of the discussions today.
We just wanted to show.
So
We just wanted to show the last slide.
Oh, yeah.
To get CME, we just want to show the. Oh, maybe not.
How do you show it? Coming up? What's,
It was in presentation.
I know.
No, he took it off.
Jeff was president of his AV club in high school. We need him around. Yeah, well, you'll see on the app how to get CME
There
for
it is.
Oh, there it is. How to get CME for this. I had slides, but that's okay. So we just wanted to thank everyone. Thank you all so much for your time. You spent the whole day here. Thank you so much. And it's only a piece of the work. You'll have a lot more work coming up. So go out, have drinks, and have a great day. Enjoy the conference.